Okay, so welcome back from the break. You're still watching The Morning Rush, and we've been joined by Dr. ANITA TIBBOH from Kolebu Polyclinic, and she's been coming on the show, for the past weeks as we've been talking about cervical cancer. The month of January is the awareness month for cervical cancer. We've been talking about it, the ages that it starts for women, the encouragement that needs to come in from the men, very, very important, as we've been talking about, and a lot more, and we'll still dwell on the vaccination and all of those things. And today we're giving you the opportunity to call us and talk to Doc if you've got any questions for her, and then let's just have a conversation around it. So the number will be put on your screen very, very soon, so that you can call in and share your thoughts with us. As I mentioned, make sure that you lower the volume of your set before you talk to me on the phone. Doc, good morning.
Good morning.
It's been fantastic so far. How's the reception been? I'm sure when you get out of the studio and you get to the workplace, I saw you on TV.
Yes, we are getting a lot of comments, a lot of feedback. So it's been a good campaign.
It's been a good campaign so far. And out of the people who come to the facility to come screened, what are some of the questions that they ask maybe parents about their daughters, even the women themselves not knowing what exactly cervical cancer is? What are some of the questions that they pop to you as people are watching and getting ready to call? Maybe they also have those questions that they want to ask.
So a lot of it is mainly about the symptoms that they might get, because a lot of women have issues with vaginal discharge, and they are not sure which vaginal discharge is abnormal.
Okay.
Yes, and so that is mainly what they ask about. And then also vaccination, how available it is. Yes. So basically, if you are looking at vaginal discharge, the symptoms, it's mainly bleeding in between your menses, bleeding after sex, or you are a menopausal woman, you haven't had your menses for years, and all of a sudden you start bleeding. So those are some of the symptoms that would alert you that cervical cancer may be lurking. When it comes to vaginal discharge, if all of a sudden you start having profuse vaginal discharge, or it is offensive, which means it smells really bad, you need to go and get it checked out. There are other causes for vaginal discharge, and cervical cancer is one of them. So you need to get it checked out so that we make sure it is not cervical cancer. And if it is, there's something else. If we catch it early, there's definitely something that can be done.
Okay. And looking at how sensitive this issue would be, like, I mean, if you call and you decide not to mention your name, I'll be fine. I'll be fine with that, because at the end of the day, it is whatever that you're going through that we want to sort out. And looking at this as a very sensitive thing, I know it'll be quite. People will be skeptical calling and mentioning it. So you can call. The number is on your screen right now: 0550 090702. That is the number you can call us, and let's have a conversation around cervical cancer. In Ghana, what is the average percentage of women who have this particular issue?
So it's actually the second most frequent cancer in Ghana.
Second most frequent cancer?
Yes, in women in Ghana. Women? Yes. So worldwide, it's the fourth most frequent cancer, but in Ghana, it's the second. And even worldwide, apart from being the fourth most frequent cancer worldwide, 90% of new cases and about 90% of deaths occur in developing countries, specifically the sub-Saharan African countries. And Ghana is in sub-Saharan Africa. Oh. So we are contributing to the high mortality, the high death rates, and the high incidence. Yes.
Wow. Okay. That's quite, because if worldwide it is fourth and in Ghana it is the second, then we really have an issue at hand. And from the authorities, the health service, the Ministry of Health, this is like one of the things that we really need to be talking about. And that is why we have given our platform to talk about this. I was told there was the first caller. The line is dropped. Please do call back and let's talk. 055 0090702. That is the number you can call, and let's have a conversation. Dr. ANITA TIBBOH from Kolebu Polyclinic is here. You can talk to her about any of the issues that you're facing, and that will be sorted out for you on TV, and then later you can, of course, come to the facility or any facility near you. Also, the vaccination, we're talking about it the other time, that it is what may scare. Okay, first, the screening. People would have to come for the screening, and then after there has to be the vaccination. And knowing that this is something that, as you mentioned last week, could be with you for a very long time that you don't know about. How will someone be convinced that I need to go to the hospital? Because I've been seeing anything.
That is what should convince you. The fact that it can be with you for as long as 15 to 20 years. So it starts out as an infection. And so like I mentioned last week, HPV is the cause of majority of cervical cancers.
Okay.
It starts out as an infection. So you get the infection mainly from sexual contact. So, but then there have been people who have not had sexual contact who have had cervical cancer. So even if you have not had sexual contact, it's important that you should go for screening.
But how would that happen though?
So like I mentioned, the HPV, it can infect skin, it can infect the genital area, it can infect the mouth and the throat, it can infect the cervix, yes. So there are various ways you can pick it up by getting into contact with other people. And it is usually through some form of sexual contact, not just the normal sexual activity. And so when you pick it up, your body is able to clear it within about 1 to 2 years. But the thing is, if you keep getting infected, you develop the chronic or persistent infection. Then that will develop into precancerous lesions. And then that would further develop into invasive cancer. And so there is a wide, there's time. There's time for us to be able to pick it up. And so it can be with you, and most of the time it's not symptomatic. So you may not be getting symptoms until you actually get the cervical cancer. So if you don't go for screening to be checked so that we are sure that it's not there, then it means that you might be harboring it until you develop symptoms. And then by which time it's probably going to be more involving or too late. Yes. So it's very important that we get screened. It's extremely important. Whether or not you've had sexual contact is very important. Visit a health facility and talk to someone so that you are screened.
And when it gets to that too late part, there's nothing that can be done about it.
So there's nothing that can be done with respect to the effects of the disease, which is it being fatal. But then there are other things that can be done to make you more comfortable, to prolong your life a bit. But when the illness has spread, and has spread into major organs, most of the time, the fatality is inevitable. Okay.
Wow. And what is the mortality rate like?
So currently, I think within the past 5 years, we've had almost 17,000 people dying from cervical cancer.
17,000 people?
Yes, women.
Women?
Yes.
17,000?
Yes.
The last 5 years?
Yes.
Wow. That's a lot of people.
That's a lot of people. It's especially in our part of the world, because we don't present early. That's what causes the problem.
Okay, all right. So let's, as we get ready to wrap up on the conversation, we're still hoping to have your calls come through. As I mentioned, this is a very sensitive topic, and so I know a lot of you would be skeptical about calling and talking about your issues on that. Okay, so if you're trying to call, we'll get that later as the show progresses. But Doc, the month, we're in the middle of the month, and the whole of January is for this. What are the other things that are happening at your outfit? Okay, so at Korle Bu Polyclinic currently, we are running a women's clinic. We do screening every Thursday from 8 to 2 p.m. Okay. So we do two kinds of screening. The visual inspection by acetic acid, which is vinegar. And that's about 50 cedis. And then the pap smear, which is 150 cedis. Okay. So every Thursday, Korle Bu Polyclinic, between 8 and 2, we are available to do the screening. Okay. Then on the 26th of January, we'll be doing free screening for the first 100 women who come to the polyclinic. So 26th January, the first 100 women, free
screening. So when you come, we'll do the screening for you free if you are within the first 100. After that, you will have to pay the normal rates.
Okay.
Yes.
All right. Dr. ANITA TIBBOH, thank you so much for coming in this morning.
Thank you for having me.
And to our viewers, apologies. There were some issues with the lines, and so maybe you tried calling, you couldn't get through. Apologize for that. Dr. ANITA TIBBOH, thank you so much for coming through. She's with Kolebu Polyclinic, and she's been helping us with the conversation on cervical cancer for the past weeks here on the show. So please make sure that you go out there, go get screened, and then you can get the vaccination. Also very, very important. And to the men, also encourage your people, your wives, your girlfriends, your mothers, grandma, everybody to go get tested.